Hi, good evening. My name is Weiwei Wang. I am the Executive Director of the Vermont Health Equity Initiative, or VHEI. We are among the first BIPOC-led community organizations dedicated to health equity in Vermont. We were established initially to focus on organize and promote BIPOC COVID-19 vaccination clinics to a community historically overlooked and mistreated by the healthcare system. In addition to COVID-19, VHEI is dedicated to prioritizing and bringing clarity to racial health inequities across the state of Vermont and those that are embedded in our nation's legacy of systemic racism. I want to start by welcoming everybody to the first in our BIPOC Community Conversation series. We will be offering additional series over the course of the next few months. So please keep an eye out on our website and through our social media channels. So now I'd like to introduce my colleague, Luis Calderon, who will be introducing our speaker for the evening. Luis.
Thanks, Weiwei. Hello, everybody. Luis Calderon here, also part of Vermont Health Equity Initiative. It is my honor to be able to host this conversation this evening with our good friend, Dr. Anthony Williams. With us also on the line this evening is Karen Vastine. Karen is of the Office of Government and Community Relations at UVM Health Network, and she has been an integral part of helping our organization connect with their organization and others in the community. So thanks for all your effort, Karen. Tonight's discussion is focused around protecting young Vermonters from the COVID and the COVID-19 vaccine. We will be discussing the status of COVID-19 and the vaccination progress in Vermont. We will be reviewing information on the vaccine for children. We will be discussing the benefits, risks, and side effects. And we will be talking about how to get the vaccine. We'll then have some time for questions and answers, and then we'll share some resources for families. At this point, it is my honor to introduce our friend and colleague, Mr. Dr. Anthony Williams, family physician at UVM Medical Center. Tony, how you doing?
Good. And again, thank you so much, everyone, for inviting me. I'm very grateful to you all for this opportunity and for all the work that you have and will be continuing to do. So again, thank you all. And thank you again to the audience for taking the time to be here. I know we're all busy with our families and just really trying to navigate this difficult time. So, you know, any opportunity we can use to work together around this is wonderful. So again, thank you all. And as Luis has mentioned, we will be talking about the COVID vaccine, particularly the pediatric dosing, and how we're going to utilize that in a way that is safe and hopefully productive and effective for everyone. So we're hoping to answer some questions around that. And again, I'd like to keep this as sort of an open space. If you have any questions around this, I like to keep it all pretty informal. So if you want to ask during the presentation or after, that's absolutely okay with me too. So again, thank you so much. And yeah, it's not necessarily a PowerPoint, it's more of a PDF. So I'll just kind of slide down the screen. So hope everyone's okay with it, to bear with that. But this is more or less an overview. We'll kind of bring up the introductions, which we have. We'll talk about the status of COVID-19 and how vaccinations have progressed in Vermont, along with information on the vaccine itself, risks, benefits, and side effects, how to get the vaccine, and we'll have some time for a Q&A and then some resources for families as well. And this is a picture of myself back when my hair was much shorter and I had less facial hair as well too. I think I was 28 or 29 around this time. So yeah, I got a little bit lazier as my older age.
Gotta get a new bio picture.
Yeah, I know. It's been a bit of a time for that. So yeah, I'll have to get around to that. But yeah, so we'll jump right into it. Just talking about the status of COVID-19 and how the vaccine progress has been across Vermont right now. And right now, where we are currently, Vermont's really had a large increase in the number of cases over the last few months. And most people, I imagine, have seen blurbs in the news about this and stuff. And we're all kind of wondering, like, hey, didn't a lot of us get vaccinated already? And, why are we having more cases than we have before? So that's been a topic of confusion and for a lot of questions in general. So we're hoping to try to navigate that a little bit. Hospitals in particular at UVM have been very, very busy, along with associating hospitals at Northwestern and Alice Hyde. We're seeing quite a large number of cases. I think last few days ago, there were about 83 to 84 cases of COVID patients in the hospital, and then 25 who were in the ICU as of yesterday. So it's still quite serious. And again, 75% of those COVID hospitalizations have been unvaccinated patients at UVM Medical Center. Chittenden County in particular has had higher vaccination rates comparative to other counties. The cases have been remaining fairly stable amongst that population there. We're thinking overall, though, that with enough immunity, we can sort of transition from this sort of pandemic, this worldwide pandemic, to sort of an endemic event, which means that it's a smaller concentration of people who get sick, similar to what you see with the flu. So, unfortunately, we're seeing more, but we're still sort of trending in that right direction as long as we continue with that vaccination consistency. And then there's the new kid on the block, which is the Omicron variant. And a lot of people have been hearing about this in the news as well, and how it's sort of dodging the vaccine and how it can spread more and all of these other things as well. Currently, it's predominantly in South Africa that we're seeing it. And it's being studied in the medical community as well. In the New York Times, you'll hear a few things about it. But some of the key points are being that it's more contagious. We're seeing that it's most likely more contagious than other variants. Overall, it appears to be less severe. And there were more cases of, but not more patients who are being hospitalized. The vaccines still do protect against serious illness. So even if the Omicron variant can dodge most of what the vaccine does, the vaccine still does protect you in a large way. And then we're also seeing as well that the COVID-19 testing that you're doing at home and the PCR, which is through the nose, sometimes far into the back of the nose, they're still capable of detecting the Omicron variant as well. So now we're going to delve a little bit into the cases. We're going to try to keep it to the surface level. So overall, I just want to show everyone sort of the collective trend. And let's see, I have a cursor here. So number of cases by week starting in January of this year, it was around this point, and these are adults and these are children, and I believe that's orange. My vision is horrible. But we're sort of seeing that it stayed sort of consistent, like above 1,000, then below 1,000, then it kind of petered down in the summer, and we were doing pretty well. And around this point, we're actually seeing a large concentration of individuals who were vaccinated at the time, so there was less of a chance of COVID sort of rearing its ugly head. And then what we ended up seeing was sort of a wave, and large numbers of cases were increasing again, and we're starting to see them spike and peak. And this is the reason for this is twofold. One is, again, there were still individuals who were not vaccinated. And this was around the Delta variant when that came about. So it was spreading, and Delta was pretty rapid. So it spread quickly in the setting of people who didn't have the vaccine. But then you also had individuals who did have the vaccine, and then the effect from the vaccine was still there, but it just wasn't as strong as it used to be. So there was an opportunity for the individuals who were vaccinated to get sick, most of them very mild symptoms, but they could still pass it on to others. And then you would have cases of people who were sick with mild cases, or individuals who were sick and not vaccinated. And then we're also not accounting for pediatrics as well. And we're seeing here that the increase in kids who got sick was a lot higher compared to back in the early years. So there's a few things that were going on at the time. And then this graph just separates the pediatric cases by age. And again, we're seeing a larger volume of kids who were in the sort of 6 to 11 year range. And that's primarily because they're grade school and kind of going in and interacting in classes. So yeah, we did see an unfortunate rise again, and currently peaking. And this is just more of another depiction of what that is referring to, is sort of the rates by week. And again, we're just seeing sort of that steady here, and then it goes down by summertime, and then there's that uptrend. And then here's another one as well. And this relates the number of kids who did develop COVID and unfortunately die from it, and they separate it by age. And we're seeing that around like 94 of those COVID deaths were kids who were ages 5 to 11. Unfortunately so. And this was from January of 2020 to October 16th of 2021. So almost 2 years practically, but there was quite a age range here from kids who were less than 1 year old all the way up to 18. So unfortunately, kids do die from this. So a little bit more about just vaccinating children and what that means and what that entails. The American Association of Pediatrics, they recommend the COVID vaccine in particular for children and adolescents ages 5 years and older who have no contraindications to the COVID vaccine. So that's sort of the blanket generalized approach, and how the American Academy of Family Practice, which is my group, we also operate under this jurisdiction as well. So COVID-19 in children. So as we all know, COVID is dangerous for lots of people, and including kids as well, and it can really impact their health significantly. Most children get better with COVID. In particular, they can just relax at home, drink lots of fluids, take Tylenol every now and then when they need to. But sometimes serious things can happen, such as pneumonia, which can be triggered by COVID, something called multi-system inflammatory syndrome. And basically what that means is that your immune system just really responds very strongly to COVID, and it causes your organs to also work themselves too hard, and that can cause organ failure over time. So basically it's a whole body response to an infection, and COVID can do that. And then many people may have heard of long COVID or long haul COVID, and essentially you see kids or adults even who gotten COVID gets better, but then all of a sudden they're still feeling very tired a lot of the time. They're short of breath. Sometimes they have heart palpitations, body aches. It's these random sporadic symptoms that seem to happen over a long period of time. So that is something that kids do also experience, unfortunately. And then there is data to show that kids who are, adolescents in particular, who are not vaccinated are 10 times more likely to go to the hospital due to COVID than those adolescents who were vaccinated. So the data has thankfully been consistent as far as reporting that kind of information. But regardless of that, anyone can pass COVID to someone else if they do get it. So again, the goal of vaccinating people is to reduce the risk of developing symptoms, but even if that does happen, you reduce the risk of getting really sick and going to the hospital. So there are two approaches here. Some more information just about vaccinations around COVID. It's similar to most other vaccines that you get, in that, you can go into like a local pharmacy, you can go into your doctor's office and have it administered during the visit. There's research to show, again, that it is very effective, and kids have lesser chance of getting COVID-19 with the vaccine in place. And then even so, if they get it, less opportunity for them to get seriously sick or ill. With passing the vaccine, with passing COVID on to others, the thinking around that is that when if you do contract COVID, you may not have symptoms like cough, or you may not have like fevers and those kind of things because of the vaccine protection. And the reason you can transfer COVID to another person is if you cough, or if you're not washing your hands after you cough. Like if I cough my hands, do this, and I high five someone, there's a possibility of passing it on to them. If you don't have symptoms where you don't develop that cough, you may not have that chance to pass it on too. So there's an opportunity to sort of prevent that transmission, and especially amongst elder individuals like grandparents, your parents and family members as well. And I mentioned previously about how the vaccine can last for a while, but then it can peter off. We're still trying to see how long that's for, though. So, that's still an ongoing area of research currently. So a little bit of information about how the vaccine works, particularly Pfizer, because there are a few vaccines and a couple of different ways that they do what they do. The one that we're referring to with Pfizer is an mRNA vaccine, which basically the best way I like to think about it is it's a blueprint or basically an instruction manual. And what we do to the body is we give this instruction manual to the body, and the body says, "Oh, okay," and it creates something from it. So what it creates is this thing called an antibody. And the antibodies are designed to look around the body, and if there's any COVID around or any COVID around in some future period or time, it latches right onto it and gets rid of it. So that's the way it's designed to work. That's kind of how I think about most things in life. But with the mRNA vaccine or excuse me, the mRNA itself, it doesn't stay in your body forever. So it stays for hours to days before it just disintegrates and goes away. So it's not like it stays in your system. So your body basically grabs those blueprints, makes something from it, and continues to make things from it going forward, while the initial blueprint just kind of dissipates and goes away. So this gives your body a safe and useful opportunity to create something and make itself stronger, almost like a factory. What happens with COVID is when you get it. So the same thing happens where your body sees that this COVID is here, and it will still create those antibodies because it uses the virus as a blueprint. But what happens is the virus gets inside certain cells of your body, and it just makes more of itself. So it replicates and replicates and replicates, and your body can't really catch up fast enough to keep it from spreading. So you still develop antibodies, but COVID will just kind of do its own thing while your body's really trying to build its defense. So it gets really tricky sometimes, but that's the thinking behind like why we vaccinate in general, is so your body can build up these soldiers to kind of search around and find whatever virus is trying to protect you from. And I'm happy to answer questions about that going forward too, if that doesn't make sense. I know there's a lot that's involved with that. So again, I mentioned about the Pfizer vaccine, and it's very similar to the adult version, except we're using a smaller dose, 1/3 of what we're using for the sort of the normal dose here. And what we're finding is that kids have still a very strong response to that, and they can make lots of antibodies from that smaller dose, and that's 10 UG, which is micrograms in this setting. So kids really develop a notable response from that. And it's similar in that you get the first shot, and then you wait 3 to 4 weeks, and then you get the next one as well. By the second dose, you have to wait a whole like 2 weeks before your body has made enough antibody and enough of those soldiers to really, really protect you from COVID if you were to ever get it. And again, we're seeing that it's about like 91% effective against COVID infections. And that's been with consistent research that's been done over the last several months, surprisingly. And I think that's nothing short of a miracle. Just being very transparent, I was nervous about the COVID vaccine at first, especially as an African American. But one thing that I have been seeing so much of is how consistently effective it's been, and that was enough to make me feel comfortable with it. When you see consistent data like that over a span of time, and for kids, we're seeing that it's even more remarkable. So thankfully, I think a lot of that information is consistent. We're not seeing any serious adverse events as well related to the vaccine, and we'll get a little bit more into that as well, because I know there are definitely some concerns about a couple of those issues in particular. And then as of now, I would say over the last few weeks, about 12.6 million kids 12 to 17 have been fully vaccinated. And so far, the data from side effects and those things that have been collected have been very reassuring.
Tony, would you mind taking a question?
Yes, of course.
So this just came in from Roz, I think you go by. Why is the dosage based on a child's age versus their weight?
Yeah, so it's a good question. So with weight-based dosing, it's very difficult to sort of get a response from if you're able to check and see how many antibodies are made for a person. It's hard to say how much is made based on weight. So let's say I got someone who is 200 pounds and someone who's 50 pounds. If I were to give them the vaccine, the dose may be the same or be different, but the amount of antibodies that are produced are not based on weight. So that's based on how strong and how mature your immune system is. So that's the most important part, is how mature your immune system is. And kids in general, because their body is young and spry, their immune system very similarly is like, all right, let's go, let's get stuff done. As opposed to someone who's older and their immune system is probably like, what's going on? And it has to get the wheels going a little bit before it can do what it needs to do. So with a higher dose of the vaccine, in theory, you give your body enough of a push to make enough antibody. But for kids, because their immune system is so spry already, they don't need a lot to really get that ball rolling. Does that make sense? And if not, just please let me know. Sorry, I see that's in the chat here. Okay, great, thank you. That was a very good question. Awesome. So as far as vaccine safety, again, I kind of alluded a little bit to how the data has been consistent as far as it being effective. But the other thing, again, is the big concern about making sure that we can give this to our children, and I have 2 kids as well, 9 and 3. And man, if I try my very best to keep them safe. And I was also worried about this being a possible issue or concern as far as the safety factor. But the data has been, again, so consistent as far as it being safe that it's reassured me. So we're seeing from that research that they're doing sort of what we call randomized placebo-controlled trials, where we basically get 2 groups of people, and we're doing we give one group the vaccine and the other group a placebo, and we don't know which group is which, and neither do the patients. They don't know which group they're in. That's the ideal way to get the most accurate data when you're doing a research study. And for these kids, we were able to find that we got consistent information enough to say that the vaccine was safe, and that and that the information was also going to carry forward if we did this in real life. And there haven't been any developmental impacts with the vaccine or any biological effects. So now we're going to look into some of the side effects in particular, along with the risks and benefits. So with this slide, I think it's good to make some comparisons as well. And if you look on the left, as far as children and adolescents who've been affected by COVID, we're seeing that the number of new COVID-19 cases remains high in the US. And I think a lot of that has to do with the fact that many kids still are in the process of getting vaccinated or have not been vaccinated yet. And we're all, many of the kids are still going to school. So the risk of transmission is high too. Because more kids get infected, there's a higher chance of kids going to the hospital. And we're unfortunately seeing larger percentages of that nationally. And again, unvaccinated adolescents, a 10-time risk higher than vaccinated adolescents with hospitalization. That multi-system inflammatory syndrome, so where all of your organs sort of flare up and you get a response, we've seen about 5,000 cases of that so far, and about 50 deaths as results of complications from that due to COVID. Long COVID as well. Again, we still do see that in the community, and I unfortunately have patients kids who do have long COVID symptoms, and it's pretty hard because they can't play sports. Like, they're really exhausted when they're in practice, and they have to use inhalers just to help with their breathing. So it can be very life-changing. As far as myocarditis, and I know that's, again, probably something that some groups may have heard a lot about and may have more questions on. And myocarditis, essentially what that is when the heart gets inflamed. So how I was saying your organs sort of rise to a response, but your heart in particular, it gets really, really activated, and it can become inflamed and irritated, and it causes chest discomfort. It can do a lot of things. But that being said, there were concerns about it with the vaccine, and we haven't really seen that in cases, strangely enough, and thankfully enough, in kids who are 5 to 11 years old. We actually did see maybe some very rare cases in young adults, young adult men in particular, but it tends to be very mild and gets better by itself. However, you do have individuals who get COVID and do develop myocarditis, and it can become pretty severe because your body's also having to battle COVID while also trying to help with the heart So it's two different things going on at once. So when you have to compare like getting the vaccine and, you know, the extremely to negligible risk of myocarditis compared to getting COVID and getting myocarditis that way, it's just, there's a lot of risks that goes with that as well. And as you can see here as well, the risk of infection rate and development of myocarditis is 34 times higher comparative to those who get the vaccine. And then you have individuals who don't get side effects at all, which I do see quite often. My daughter, she got both doses of the Pfizer. Her last one was this past Friday, and I don't know why she didn't feel anything at all. I remember feeling tired and just, you know, a little bit spacey, but then that got better. But my daughter was just running around like a mad child the day after she got her second dose, and she was doing a-okay. So again, I think that speaks a lot to the resilience of kids, and I think it also speaks as well to how the dosing impacts the kid's ability to build a nice response and still be safe and happy and healthy. But if they do have side effects, these are some things that you can see, like redness, swelling. Some kids feel tired, some kids get headaches, but they're temporary. They tend to go away usually after, I see on average 6-7 hours. Some kids, it could be a couple of days beyond that, but most kids tend to respond pretty well to it. And again, I know I mentioned with myocarditis as well that we haven't seen any cases of that in sort of the 3,000 randomized, placebo-controlled trial that was done already. So again, myocarditis is more likely to occur if you get COVID comparative to if you get the vaccine. Yes, Karen.
I'm not up on this, Tony, but I think as of last week, there hadn't been anybody who'd received between 5 and 11 who'd received the vaccine who had myocarditis either. Have you heard of any cases even in the last week? Because if so, then nobody's gotten it even outside of the trial.
Yeah, I haven't heard anyone, and I've been trying to keep an up-to-date look at that. Again, what I have seen is very rarely sort of young adult males. That tends to be the big one, if it does happen. And if it does, it's still very mild and it heals on its own. Again, just very, very rare. Good question, Karen. Thank you. All right. So now with getting the vaccine in particular, and I'm not sure if this is my point, or I don't know if Wei.
I'm happy to jump in here. Thank you.
Sure.
Yeah, so in terms of signing up, the Vermont Health Equity Initiative is offering Saturday clinics through the end of March. So you're welcome to come onto our website, vermonthealthequity.org, to sign up for you and your children. The adult boosters are separate from the children sign up. So look for a little link in the adult sign up for the 5 to 11 signups there. And children must be accompanied by either a parent or a legal guardian. And also we should note that, sorry, one more thing.
Sure.
AALV is also offering clinics every Thursday at 20 Allen Street as well. So that's from 5 to 8 p.m. They are also offering pediatric vaccines. Next slide.
Of course.
Thank you. And on our website, we are also offering multilingual resources. So please visit our website. The Vermont Department of Health, as well as Dr. Andrea Green, have provided resources that you can link via our website. Back to you.
No problem. Thanks so much for that, Wei. And then, yeah, so overall in summary, I just wanted to kind of paint that picture if I could, but really kids in particular who get vaccinated, there's more of an opportunity to see their family. And, you know, there's less of a concern about going to school and having to worry about them missing days or missing a week because one of their classmates was sick and you don't know who it is, and you have to just make sure that your kids are home and have them get tested. My daughter, before she got the vaccine, had to do 3 weeks straight of that. And then my poor wife, who's so diligent about trying to help us out, like she carried the brunt of that while I was also working, and her job is just as hard as mine. But it can be straining on families. So if there's an opportunity to prevent that with the vaccine, then I think that would just relieve a lot of stress for the kids and then for families as well too. Really, again, the vaccine is the best tool that we have to stopping this pandemic and to really changing it. That way we can get back to a degree of normalcy. So it's still very important now, just as it was back when this all kind of started too. For just individuals who may not be related to you, the vaccine is still great at sort of preventing transmission of disease. And other individuals who are older, the risks of them getting sick because you're vaccinated becomes a lot lower too. So there's so much good that we can do for others just by protecting ourselves as well, and our families. And then there's a little blurb here as well, which is, again, I think a very important point is that non-Hispanic whites have higher vaccination rates than BIPOC Vermonters for those ages 5 to 12. However, BIPOC Vermonters continue to have a higher rate than non-Hispanic whites in age groups 12 to 30, 31 to 64, and 65 and up. So I think there's sort of this increasing trend, which is good because one, it drives sort of that degree of protection and everyone getting vaccinated and sort of reducing the risk for the pandemic or the incidence of the pandemic. But at the same token, it also sort of improves that motivation to vaccinate and protect. So I think there's a lot of good that we're doing, and there's just nothing but opportunity. There really is for us to get rid of this thing and really just protect our family in general. And then finally, as Wei had mentioned, there are some resources here for families. If you are interested in looking into any of these in particular, the links are very accessible and it's very user-friendly. So if you are interested, please feel free. And we, there's a lot of resources as well, and we try to also make ourselves available to help too. Thank you so much. And if you have questions, I'm happy to answer them as best as I can, but thank you for taking the time to listen. I'm very appreciative of that.
Thank you very much, Dr. Williams. That was really, really informative.
Sure.
Honestly, I think that was the best description of how the vaccine actually works for me to understand it in this entire time. I think it makes sense for it to have a pediatrician, have it told through a pediatrician's lens, to really make it easy for someone like myself to understand what it is that's happening in here now in my body, now that I have had my vaccine and my booster.
Cool. Yeah, absolutely. I'm happy to help. And I'm glad it was, the explanation was okay.
Yeah, it was great. I have a few questions that came in, in advance of our talk here, and wondering if you might be able to take a crack at a few of these.
Of course.
One question is, will children also need a booster, much like the adults, after 6 months? We've been told that, or we're experiencing, we got to get a booster, as you mentioned. It was about a 6-month mark. Do you think that children will also then need a booster 6 months after their vaccines?
Yeah, so that's a really good question, and it's one that continues to come up. Many of my patients also ask about it. At this point, it's still difficult to tell, just because we're still trying to get a lot of preliminary information around how the vaccine is working to reduce the risk for communities. But we're also still trying to track how effective it is. And back when we first did this with adults, we didn't necessarily have that information, that it would, we didn't expect that it would be 6 months. Some people were saying shorter, some people were saying longer. So I think, unfortunately, the only way we'll know is as we trend and see how the effectiveness goes. One thing that is a strong correlation is the volume of antibodies that are produced, or the amount of antibodies that are produced when someone gets vaccinated, can sort of determine how long the protection extends for. And kids, again, they have a strong immune system, so their immune response is very strong when they first get the vaccine. But then the body also has the ability to create more antibodies over time, and those particular parts, those particular cells, are very diligent. and they continue to work and work and work. So it's very possible. And again, I can't play God here, but I would say it's very possible for the vaccination protection to last even longer because of how strong the immune response is for kids. So I unfortunately don't have a direct answer, but I'm hopeful.
Mhm. Okay, thanks. And another question that we've heard over the time is if a child has already had COVID or had previously tested positive, do they still need to get vaccinated?
Mhm. Yeah. So again, that's also a very good question, and the answer is yes. Primarily because of the fact that even though you develop antibodies, though the protection that you get from that does not last as long. And that could be due to a couple of factors. That could be due to just the fact that your body was stressed when it was fighting this thing, and you don't have as strong of a response because of that. It could be because the cells, those factories, that the portion of the factory that produces more of those antibodies over time, they just don't last as long. But for whatever reason, we're seeing that the protection doesn't last for as long as the vaccine does. So if that is the case, someone can get COVID again, and then there's no guarantee that it wouldn't be severe the next time, or it wouldn't cause any further problems. So yes, my recommendation would be to get the booster, just to give yourself that more dedicated protection based on data that we have been seeing consistently for several months.
Thanks. Wait.
Yeah, kind of following up on Luis's first question, will the vaccine then protect the kids from Omicron?
Yeah, so yeah, that's a very good question. And Omicron, again, this is all based on initial data in that it does appear to evade some aspects of the vaccine, but we're still seeing that the vaccine is effective in reducing the risk of serious illness. So that being said, someone who does get the vaccine may still get Omicron, but the possibility of it developing into something serious or dangerous is lessened because of that. But then there's another factor too, and that's the fact that Omicron exists because so many people got infected with COVID. So it just gave COVID an opportunity to mutate and change. So we can reduce that, and by having more people vaccinated and reducing the risk of developing another Omicron in the future. So there really is that opportunity with vaccinations to sort of prevent these recurrences from happening over and over again. But to answer your question, yes, you could get it. You could still get the Omicron infection. We suspect that it will be less severe. But again, just going forward, the risk of developing Omicron the risk of developing new variants is lower if there's more vaccination.
How do you recommend talking to kids in this age group about vaccines and why it's so important and how it won't hurt, or how do you go about your day-to-day sharing this information with young people?
Yeah, absolutely. So, I tend to think primarily along lines of what a kid would want. And most kids want to play with their friends. Most kids want to, hang out and have fun, play outside, go to Monkey Do, or go to Get Air to, jump on the trampolines and stuff. And, I tell those kids like, hey, if with COVID, it's keeping us from doing the things that you want to do. And if you do this, if you get the vaccine, not only will it protect you, but it also protect your friends, and then your friends can also get together and you guys can hang out and have fun and just be kids. And I think tailoring to what the kids want for themselves is really important, because I know that we think of kids as minors, and most of the decisions come up to the parents, but kids have thoughts and feelings, and by addressing those thoughts and feelings, I think it helps to motivate them to come up with an answer for themselves. And my hope is to just give them as much of that information as I can, and hopefully tailor it towards towards the vaccination if it works for them. Does that answer your question?
Yes, it does. That's really helpful.
Yeah, it's what I do with my pediatric patients a lot of the time.
And it's a convincing proposition when you say if you get the vaccine, you'll be able to go to get air.
Yeah, I don't think I used get air literally for one. I think it was something along the lines of I don't know, just hanging out and playing video games with your friends in their house or something. But yeah.
Right, that's good. That's good to know. You know, we're at our clinics now. We're taking in kids and you know, it's new for us as an organization, and so it's very helpful to be able to have ways to chat and connect with these young people and tell them all the reasons why this is so important. So thanks for that.
Yeah, of course. And kids want to know.
Totally.
Kids are curious. So yeah, it's great that we can do that.
Wait, do you have any more questions?
Yeah, sure. So I think a lot of my friends who are parents are concerned, even though they're very vaccine friendly, just the fact that there isn't that much evidence built up yet around the vaccination for children. And so they're concerned about the long-term effects. So I know that we don't have any evidence of that, but is there anything that you would say to parents who are concerned about that and don't want to get their kids vaccinated until there is more information gathered?
Yeah. So again, you're right in that there isn't that long-term evidence as far as, what happens with kids who are vaccinated over a long period of time. That's we're sort of looking as we leap in that respect. But the information that we do have evidence-wise as far as how getting the vaccine protects you and others from becoming seriously sick or developing symptoms, that data has been rock solid for quite a while now, over the last couple of years. And again, that's still shocking to me because you don't see things happen that often, and for it to happen in that way was nothing short of miraculous. So I think the data around that is because of that consistency as far as protection, does, at least for me personally, and as a medical provider, it gives me enough ammunition to say, this is something that will protect my children, or this is something that will protect your children. And then I think one of the things, as far as the long-term effects that we don't know about, is sort of the immediacy of it too, is just thinking about how if your kid gets sick, they could die from this. And, if we have to, I imagine most parents, if they have to choose between the mortality of their child and doing something alternative, like in this case, the vaccine, I think they probably would prefer to choose the latter. But I tend to focus, particularly my patients, I focus more so on the immediate protection and effects of it, along with sort of the ongoing observations as we go on, and how things have been very, very safe thus far, despite us not having that long-term data. But it's a very tricky scenario. But thank you for bringing that up too.
My husband and I, we've, fully vaccinated. We got the booster shots, and so has she. We're planning to visit in December, for the holidays. And her son has not been vaccinated. So I think my sister-in-law is still, she still has concerns. But when we go to visit, what precautions should we all take? Yeah.
So that actually brings up a really good point as well, is, what to do after you're vaccinated. And really, I would recommend to anyone just continuing to do what you have been doing, is continuing to wear masks, continue to exercise, good hand washing. And then just, when you're in a household, so it's hard to remain 6 feet apart from someone. So I think primarily the big things are, if if you have the opportunity to wear a mask, you very well can, but definitely hand washing, that's the most important. The concern is that the individual who's not vaccinated could potentially get very sick, or there's the opportunity for them to get sick or pass it on. So I would probably say in that setting of scenarios, just exercising those good precautions when you can. One thing that I do with my family, so again, there's my wife and I were both fully vaccinated. We've had the boosters. My daughter's had 2 doses. My son, who's 3 years old, doesn't have anything. So what we're doing is we're doing rapid tests on all of us before we go into another household. And if my daughter wants to play with her friend, she does a rapid test in our house, and their friend will do a rapid test as well. And as long as they're both negative, they can meet in a household to have fun. But that's also something you could consider doing, is rapid testing and just making sure that everyone's negative before you guys all hang out. Otherwise, good hand washing, facial coverings when able.
Thank you so much.
Of course.
Could I add something to that? So the rapid test, I know I'm so glad that you mentioned that. And they're very expensive. And actually, it was announced on the governor's press conference. So Roz, I don't know if this applies to your sister-in-law because I'm not sure where she is, but the governor of Vermont announced on the press conference today that we're working through a process to ensure that insurance can actually cover the tests. And so I know UVM Health Network has been very involved in those conversations. I don't know when that's going to come online, but that's really going to help a lot because $12.50 a pop gets expensive when you have a big family. So
thanks for sharing that, Karen.
Sure.
Thanks, Karen.
Okay, well, thank you all for attending this evening, and thank you, Dr. Williams, for all this, very, very helpful and useful and positive information. We will definitely stay in touch and hope to have you back at a later time as we continue to do these education sessions as part of an ongoing series that we've been doing and are doing this year and the following year, the next year, as our work with the Vermont Health Equity Initiative on our group's behalf. I want to thank you all for joining tonight. Thank you, Wei. Thank you, Roz, for participating. Karen, and everyone else that is checking out the video. Once again, thank you very much, Dr. Williams. We appreciate you.
Thank you so much. Thank you, everybody. Really appreciate it. So I'm happy to help, and I'm here. So just let me know if I can help more.
Thank you.
Thank you.
Good night.
Good night.
Good
Bye,
night, everyone.
Roz.